Hello, dear participants. My name is Yulia Chorna, and I'm a co-chair for the session today. We know that tuberculosis is a disease heavily impacted by social determinants, which cannot be addressed by health sector efforts and biomedical interventions alone. Poverty, lack of infrastructure to access healthcare, stigma, discrimination, and gender are just a few examples of social factors that pose barriers for timely diagnosis and treatment and influence health outcomes. Multisectoral accountability framework to end tuberculosis provides an overarching approach and a set of important tools for building strong partnerships for TB response. Our amazing speakers today, Sayhat Hasanova, WHO Regional Office for Europe, Amrita Daftari, TB researcher, York University, Yana Terleva, NTP Manager, Public Health Center at the Ministry of Health of Ukraine, and Oля Klimenko, TB People, Ukraine, will share their complementing perspectives on the value of cross-sectoral collaboration and ways for implementation of the multi-sectoral accountability.
Participants, my name is Yulia Kalanchati, TB Coalition Executive Director, and I'm chairing the session. In 5 pilot countries of EECA region, TBEC, through technical cooperation with WHO Europe and collaboration with national governments, civil society, and community partners, supported baseline assessment of the multisectoral collaboration and accountability. In particular, focus on assessment of the status of engagement of civil society and communities in TB response. Data received during the assessment generated knowledge and evidence for strengthening multisectoral collaboration and accountability at the country level. Civil society and affected community which took part in the assessment defined their meaningful engagement in TB response along line with interdependent elements of public participation and availability of sustainable financing for operational activities and service delivery. TBEC will further work with national stakeholders to ensure that evidence received through MAF TB baseline assessment inform national TB strategic plan and governments of the national TB programs.
Good afternoon and good evening, dear participants. It's my honor to present you the WHO Regional Office Europe work in operationalization of MAF TB at regional and national levels. I have only 6 minutes and to be in time and not to miss any important points, with your permission, I will read my presentation. Progress in combating TB cannot be achieved by health system alone and requires firm political commitment at the highest level, strong multisectoral collaboration beyond health, and an effective accountability system. This is especially important in the current context due to the COVID-19 pandemic impact coupled with ongoing crises such as armed conflict, increasing food insecurity, political and economic instability that has reversed years of progress made in the fight to end TB and placed an even heavier burden on those affected. Since 2019, countries have been supported in systematically adopting and implementing the multisectoral accountability framework to accelerate end TB, in short MAF TB, by WHO in collaboration with partners. And this framework is well aligned with the NTB strategy and 2030 Agenda for Sustainable Development and aims to support effective collaboration within and beyond health sector and accountability of governments and other stakeholders at global, regional, and country levels to ramp up the response towards ending TB. To support countries at global level, WHO developed 2 documents, an operational guide and the compilation of best practices on MAF TB adaptation and implementation. The operational guide provides practical advice on key approaches and interventions needed to establish the MAF TB at national and local levels, and the compilation of best practices includes case studies from all 6 WHO regions and provides important insight on how regions and countries are progressing with MAF TB implementation. WHO is also undertaking capacity development efforts to enable MAF TB adaptation and implementation at country level through virtual orientation webinars, including in collaboration with Global Fund, Stop TB Partnership, and other partners. To facilitate information sharing among all member states and stakeholders, WHO Global TB Program launched a collaborative multi-stakeholder and multi-sectoral task force to coordinate TB response and review the progress at global level, and the MAF TB virtual network, which is hosted on WHO's interactive platform NTB Forum. And the last but not the least, WHO is monitoring the MAF TB implementation globally through annual data collection and reporting of core elements of multisectoral accountability. At regional level, to operationalize MAF TB, we conducted consultation with the main global and regional partners aimed to have a united vision and coordinated effort towards MAF TB adaptation in use in our region and to ensure its sustainability. In parallel, to support and guide countries, we developed a regional concept with suggested action points and tools on how to adapt and launch national MAF TB. And these tools we have been piloting in 5 countries of Eastern Europe and Central Asia in close collaboration with TB Europe Coalition and a Global TB Caucus. We also adopted MAF TB baseline assessment instrument, the checklist and its annexes, to support countries in data collection, analysis, and consolidation of results with recommendations to strengthen multisectoral TB response and accountability. Through the Regional Collaborating Committee on the TB, HIV, and Viral Hepatitis, which is the European Partnership Platform, we are engaging relevant regional stakeholders in coordinated TB response. To support countries at national level, we provide strategic advice and technical support in developing country-specific national vision and roadmaps on strengthening multisectoral collaboration, coordination, and accountability, in establishing national multisectoral coordination bodies and high-level review mechanism, and in addressing MAF TB in the national strategic plans for TB and funding application to external donors. To meaningfully engage civil society and affected community in multisectoral TB response, we developed a roster of consultants representing civil society and affected communities, and in partnership with TB Europe Coalition, conducted a workshop to build their capacity in monitoring and review of national TB programs. And civil society and affected communities in our region, as you know, are part of the multidisciplinary team in conducting reviews of national TB programs. This slide demonstrates the suggested main actions to adopt and launch MAF TB in pilot countries, and this slide summarizes the progress countries have made so far. As you see, all 5 countries completed baseline assessment, and they are at different stages of development of their national MAF TB vision and roadmaps. All countries define their multisectoral coordination bodies, however, they need to be strengthened and their roles and responsibilities need to be revised to meet the MAF TB principles, and countries do not have the high-level review mechanism yet. However, establishing this mechanism has been planned in their national TB strategic plans and will be implemented with technical support of WHO. Taking this opportunity, I would like to thank and acknowledge all colleagues and partners contributed to MAF TB adaptation and implementation in the WHO European region. Please feel free to contact me if you have any questions or further clarifications. Thank you very much for your attention.
Thank you to Yulia and Yulia for including me in this important session on MAF TB. It's an honor to be amongst my fellow presenters, Sahayorat, Irina, and Olia, and to have this audience. Following on what Sayohat has just shared, I'd like to talk about some methodological adjustments, or rather additions to the MAF TB baseline assessment that we applied in 5 countries in the WHO Europe region that perhaps others who are undertaking assessments on multisectoral action and accountability would find to be useful. I'm speaking today in my role as a researcher who contributed to methodological processes, but I won't be sharing results of the assessment itself, as I believe those are going to be shared in other venues and forums. I have no conflicts of interest to declare. I would like to acknowledge all the wonderful and productive people who were involved in this effort, our civil society and TB-affected community organization partners in Belarus, Kazakhstan, Moldova, Tajikistan, and Ukraine, the endorsement of the NTP, of course, without whom we could not have done this work, the team at TB Europe Coalition, especially Yulia Kachanka and Yulia Chorna and Evgenia Lukash, and supports received from WHO Europe Office and the Stop TB Partnership. As Sayohat could have mentioned, countries adopting MAF TB are requested to complete a baseline assessment checklist to see how collaboration and accountability in TB is working beyond the TB program, beyond the health sector. And this checklist asks fairly categorical or yes/no questions about whether declared commitments are being translated to national policies and strategies, specific actions that are being undertaken to support multisectoral engagement and collaboration, and whether there is a monitoring and review mechanism in place at the country level. And the checklist also includes 3 annexes that can be adapted by country, NTP, and stakeholders that are directed, 2 of them are directed at stakeholder groups involved in the NTB response, so government ministries and bodies, and civil society and affected communities. And the final annex is focused on utilizing WHO guidelines at country level. So in 2021, 2020, the TB Europe Coalition, working with the WHO Regional Office for Europe on MAF TB, partnered with civil society and TB affected communities in 5 of the countries that I mentioned earlier. And with endorsement of NTP, we decided to adapt Annex 2 of the baseline assessment checklist. So we developed a protocol accordingly to collect additional data, quantitative as well as qualitative, from civil society and affected communities engaged in the TB response to complement the checklist and annex. While the checklist was an excellent tool to capture the situation at baseline and have a set of very clear indicators that we could follow over time and maintain track of actions and accountability, we did feel some additional insights would be helpful in sort of letting countries develop a plan of action for the way forward in a more meaningful way. So we administered standardized quantitative surveys to CSOs and CBOs engaged in the TB response. The survey included categorical yes/no questions from Annex 2, but also additional 20 statements, which they were requested to respond to using sort of agree, maybe, likely, agree, or disagree, Likert type of scale, to really gather some additional quantitative data on the degree and the process of collaboration, not just whether it was happening, but how much of it was happening and what were the key sort of steps in the process. So this allowed us to very quickly see the level or scale of engagement in MAF TB. As I mentioned, we sort of applied these to leaders of community organizations and civil society groups, as well as community leaders in all of these 5 countries. The second piece was a qualitative system of data collection. So we ran one-to-one interviews with the heads of CBOs and CSOs and community leaders, as well as group discussions with frontline staff. So these were field workers, program coordinators, people who had lived experience with TB, survivors, and general community representatives. And here what we were trying to do is gather a bit more rich, detailed insight into people's firsthand experiences, the challenges that they had encountered trying to apply and operationalize MAF TB. What did these concepts even mean when they were translated to action? What was collaboration? What was multiple sectors? What was engagement? What was accountability in the viewpoint of these wonderful organizations that were doing work on the ground? So aside from covering gaps, we were also interested to learn what were the facilitators, what were the motivations, and what were the preferences for the years ahead. So these data really helped to give us a more solid foundation from which ideas and plans about strengthening MAF to end TB could be envisioned and planned for every country involved. And this was an approach that not only could align with the WHO framework, but also could take local realities into consideration and increase field level feasibility and acceptability, because those will inevitably vary by setting. So the full methodology, the questions we asked, the findings that we had uncovered, they're all summarized in a wonderfully detailed report produced by TB Europe Coalition, and is available for public viewing for anyone who's interested to borrow on this approach at the link here and on the TB Europe Coalition's website. But I won't lie, performing this methodological adjustment was additional work, right? It was, but seeing that, it was so fruitful, and it was frankly quite enjoyable for all of us who were involved. Just by allowing community groups to voice their perspective through a rich discussion beyond the checklist, where they had an opportunity to tell us where they're coming from, what is it that they're going through every day. We really, I believe, secured their support, their buy-in for MAF TB, and we're able to create this environment that, we're in this together. Yes, this is an assessment. Yes, this is an evaluation, but it's to support communities to come together on a joint goal that in principle we all agree with. We also felt that the process was enabled by several consultations and meetings where we brainstormed this idea of methodological adjustment. We put together a protocol with the buy-in of all 5 countries and operationalized a plan for constant knowledge sharing, knowledge feedback, and exchange. So this became a meaningful sort of exercise and engagement exercise in and of itself. So we're now in the process of preparing a manuscript to highlight this process and the results, and we really hope that we can share this over the coming months with all of you and in the audience. So with that, I shall take pause for questions, and thank you so much for your time.
Dear colleagues, I'm happy to be a part of this session and share experience from Ukraine in MAF TB implementation at the national level. Dear colleagues, I'm happy to be a part of this session and share experience from Ukraine in MAF TB implementation at the national level. The Cabinet of Ministry of Ukraine, the Ministry of Health, and other specialized organizations have already done a lot in the direction of eliminating political, financial, and legal barriers to the elimination of TB. This is adoption of the updated standards of healthcare of TB and the involvement of Ukraine in the use of innovative methods of diagnosis and treatment, and the provision of TB facilities with the necessary modern medical drugs. But it is equally important to combat stigma and any forms of discrimination by supporting human rights protection program. The implementation of the multisectoral cooperation and accountability mechanism, which is globally called MAF TB, is one of the most important tools to overcome the main issues that lead to the spread of TB. The elimination of TB requires the involvement of all sectors and civil society in supporting people with TB, ensuring the conditions for their access to social support, the rights to education, work and protection, and others. Ukraine has undertaken a number of international obligations, the fulfillment of which will help to overcome existing social issues and contribute to the eradication of TB, in particular through the implementation of a multisectoral approach. Global commitments adopted by Ukraine shape national strategies and goals. For example, the state strategy in the field of combating HIV, TB, and viral hepatitis for the period until 2030 envisage the achievements of 3 strategic goals, including the reduction of morbidity and mortality from TB, and promotes patient-centered models of TB treatment, including ambulatory care, human rights, overcoming stigma and discrimination, implementing mechanism for financial TB activities, expanding access to modern diagnostics and treatment. The national strategy of the development of the system of TB medical care for the population is determined by the organization of the transformation of the network of TB care, the involvement of primary medical care in the direction and support of TB treatment, the optimization of the network of TB laboratories, the revision of staff policy, and the strengthening of research potential. The strategy also envisages the implementation of a multisectoral approach to the fight against TB as one of the key objectives. Now we look at schematic representation of multisectoral interaction in the field of combating TB. It is a joint effort of interested parties, which is possible only under the condition of concentrated activity. As you may see on the slide, the National Council, or CCM, is the important link in the coordination of all processes. Currently, the efforts of all partners and all interested sectors are aimed at removing barriers, and these barriers you can see on this slide. It is worth noting that the National Council involves other effective bodies of interaction, including strengthening cooperation with other platforms involving international partners and parliamentarians. As you already saw in the previous slide, the National Council is a permanent advisory body under the Cabinet of Ministry of Ukraine. The National Council is headed by a member of the government, the Minister of the Health of Ukraine, who was 2 deputies, one of whom represents the key central executive body, namely the Ministry of Social Policy, and the other deputy is a representative of the HIV community. The National Council adheres to the principle of cross-sectoral cooperation, and this is reflected in all its policies and procedures. One of the most important functions of the National Council is to act as a coordinator of the programs of the Global Fund to fight AIDS, tuberculosis, and malaria. The main objectives of the National Council include preparation of proposal for prioritization and implementing of the national policies on TB and HIV, and consolidate use of funds provided by various budgets and organizations, including the Global Fund, promotion of the coordinate activities of various partners, coordination of the development and submission of national proposals to the Global Fund, monitoring and oversight of TB and HIV programs and activities, and including the Global Fund grants. The National Council has become a platform with successful experience of implementing a multisectoral approach in national politics, in particular the state strategy in the sphere of countermeasures against TB, HIV, and hepatitis until 2030 of the Cabinet of Ministry of Ukraine declares the integration of NGOs, including civil society, into the national system of formation and provision of services. A key factor in effectiveness of measures to combat diseases implemented by NGOs is the timely adoption of the necessary administrative decision at the country level. The National Council, as a decision-making platform, has effective tool for further implementation of decisions by adapting the relevant acts to the Cabinet of Ministry of Ukraine or by a representative of the Prime Minister of Ukraine. On January 2021, it was decided to entrust the implementation of the multisectoral approach to the implementing of the political declaration of the UN high-level meeting on tuberculosis to the National Council. The National Council is responsible to the processes of coordination of the multisectoral response. After this decision, the first task to the CCM faced was to carry out in coordination with NTPs, the Ministry of Health, and with the technical support of the WHO European and TBEC to conduct baseline MAF TB assessment with the engagement of the community and civil society on the effectiveness of the mindful TB community engagement. On March 2021, a hearing of the Specialized Committee of the Verkhovna Rada of Ukraine were held, according to the result of which, and based on the result from MAF TB, baseline assessment was recommended to the Cabinet of Ministry of Ukraine to ensure the development of the national roadmap for the implementation of the mechanism of multisectoral interaction and accountability for the implementation of political commitments and target for the elimination of tuberculosis. On December 2021, the development of the national roadmap was discussed within the second national dialogue on the consolidation of efforts and planning of joint actions of state institutions, civil society organizations, including the TB-affected community. As of today, work in the development of the national roadmap continues, since the context was significantly affected by the challenges associated with Russia's war against Ukraine. But the key steps and measures remain the following: strengthening the role of the national coordinated mechanism for multisectoral accountability with sustainable funding, and implement a high-level evaluation mechanism by empowering and strengthening existing institutions and coordination efforts. Expand access to TB prevention, diagnosis and treatment, and supportive services in accordance with WHO recommendations. Coordinate efforts to combat stigma and discrimination. Apply measures to eliminate social determinants and risk factors of TB within the framework of achieving the Sustainable Development Goals. Improvement of legislation to eliminate legal barriers. Develop and implement the national research plan in the field of TB, ensure the use of research data for making management decisions, and recognize the significant role and involve civil society and TB-affected communities in relevant TB interventions at all levels. Thank you for your attention.
Good day for all participants in the Union Conference. I'm Oля Klemenko, represent the interests of TB community in Ukraine, chairman of the board TB People Ukraine and Stop TB Partnership Ukraine. The process of building a sufficient evidence base for us to be able to conduct a high-quality dialogue with all government agencies began in 2019 with the implementation of CLM and of the One Impact system in Ukraine, and continues today, as it is important to track data in real time in order to respond effectively. We understood that the adoption of community expertise would be accompanied by a number of barriers among ministers, so it was decided to use the existing resources of the organization to attract experts in order to obtain a professional assessment of the identified barriers and help the community figure out exactly where the point is for our intervention and where to direct advocacy. At this time, the TB Europe Coalition was holding a number of national dialogues in a number of countries in the EECA region, and we thought that this could be a good platform for discussing our developments. The proposal to hold a national dialogue in Ukraine was supported by the partners. The National Stop TB Partnership Ukraine has become a platform for consultation with civil society. However, we failed to achieve the result the first time. The national dialogue has become a precedent in Ukraine in the response to TB. It had a wide information resonance, but didn't have stable results. After analyzing the action, collecting feedback from partners and participants during the preparation of the second national dialogue, we changed the approach and consulted individually with the ministers, considering in detail their role in TB control and the multisectoral accountability mechanism, had better results, as the resolution of the dialogue was considered at the meeting of the CCM. For example, with the Ministry of Social Policy, we were able to agree on a number of actions to change existing policies and strengthen cooperation with the National Health Service, which is responsible for financial medical services in hospitals. Our next steps was with support of the Public Health Center, a working group was created with the broad involvement of communities and medical experts to provide an expert assessment of barriers and develop proposal for changing legislation. The group works on an ongoing basis, accompanies the implementation of CLM. We present the results annually among CCM members. Despite the war, we continue to finalize the roadmap of multisectoral cooperation and accountability. Having updated the information of the roadmap take into account the impact of the war, the pandemic, and the ongoing healthcare reform in Ukraine. We hope that the resolution of the MAF TB mechanism will be considered and adopted at the level of the Cabinet of Ministers of Ukraine. Thank you all for your support for Ukraine, and let's reach the 2030 goals together.